So kind of walk me through your journey in your office. When a patient comes in, what does that typically look like from the beginning? Are you guys doing some type of dry eye questionnaire? Are your technicians having this conversation?
So, I mean, it's like honor questionnaire, like, do you have any dry eye symptoms or whatever,
Yeah.
but like, or do you have any burning, stinging, dryness, whatever. But really, it's talking to the patient myself.
Okay.
Like, so I'll ask them, like, do you have any of these symptoms?
Right.
And then I'll look at their eyes and I can see it.
Right.
So some of the patients don't actually feel it and they're completely oblivious that they have dry eye. So it's up to you to educate them and really tell them, hey, this is what I'm seeing.
Right.
This is how we fix it. This is how we prevent it from getting worse.
Right.
And patients really respond to that because you're actually trying to help them.
Absolutely.
And you're trying to be, proactive about it.
Yeah. I love that. And, I've changed my verbiage with my patients when it comes to dry eye, and I've also had my technicians change their verbiage as well. Back in the day, we would ask our patients, do you have dry eye?
Do you have dry eye?
And they don't know what that means. Like, no, my eyes aren't dry, they water all the time. Well,
Yeah, they water all the
that's
time.
dry eyes, right? So I started asking my patients more of, do your eyes burn? Do they tear? Are they irritated? Is it
Does
itchy?
your
Is it
vision
scratchy?
fluctuate?
Does your vision fluctuate throughout the day?
So one of the number one things that people don't realize with dry eye is that their night vision
Yes.
is terrible.
Yeah.
And so they always just assume they're tired, but it's
Yeah.
actually like dry eye.
Yeah, 100%. I mean, when you think about the tear film not being healthy and
Yeah.
more jagged, I mean, those light rays are going to come in and kind of scatter everywhere for the
Yeah.
most part.
Yeah.
But I love that you touched on that because this opens up the door to a lot of things. Number one, you can help them by managing the dry eye with this device, the Optolight, right? But number two, just think about the lens solutions as well. If someone's having issues with glare at night,
Yeah.
clean up that front surface and then hit
Yeah.
them with a nice anti-reflective
Yeah.
coating as well.
Yeah.
You can clearly see this helps to build your practice and give you more, or allow you to give more offers for your patients that's in your practice
Yeah,
as well.
premium products, premium services.
Absolutely. So talk to me a little bit more about some of your best practices that you have, because I know there's a doctor out there and they're hearing 42K to the bottom line in a quarter. They're hearing these amazing patient stories of how you're just changing people's lives. Share some best practices for our colleagues out there that are listening and want to build a practice just like you as well.
I mean, it all stems from communication with the patients. And, before you actually purchase one of these, you should actually talk to the patient and see their interest.
Yeah.
It's like, you should say, like, hey, I see these rosacea vessels growing in your lid, or I see blockage in your meibomian glands.
Yeah.
And the first thing people want to do is give them a warm compress mask and send them home.
Yeah.
But it's like, you could actually talk to them about, hey, there's this treatment, light therapy, it's FDA approved,
Yeah.
and it's so safe, and it will literally unclog your glands, it will reduce your rosacea vessels, it kills the Demodex,
Yeah.
and they're like, sign me up.
Right.
You know what I mean? So
Right.
it's one of those things where if you have that discussion, it doesn't take long, you will literally blow their mind,
I love it.
and it has aesthetic benefits.
Right.
So you say, not only am I going to treat your dry eye, your face is going to look so good after. Like it evens out your skin tone, your face looks less red,
Right.
your eyes look less red. So the aesthetic benefit is crucial.
And historically, I would say, line all my women up, right? By the way, I probably have about 70% patient base that are women, right? But I will tell you this, my men are concerned now.
Yes.
Back in the day, they would just, I'm okay, I don't need anything. Bye, Dr. Glover, just give me my glasses prescription and go. Now they're starting to have real conversations with me saying, hey, my eyes are feeling irritated. I noticed these little red squiggly lines on
Yeah.
my lids. Is there anything that I can do about that? But now we
Well-
have a tool to help combat that.
Yeah, some of them come in and they're like, I look like I'm drunk.
Oh, no.
And I look like I'm on drugs all the time. Men don't want to look like that.
No, no.
They don't want to get in trouble
No,
looking like they're all messed up and they're
no.
not. So it's important to talk about it with them too.
It's a game changer.
Yeah.
What other best practices do you have for us?
Make sure you're blinking.
Okay.
Everyone, because they're on devices, they don't blink all the way. So that's one of my big ones. I tell every patient, you need to blink more fully.
I love it.
But yeah, I mean, it's just conversation.
Yeah.
Just being really open with your patients.
Communication is king. As long as you're having a conversation with the patient, you're looking
Yeah.
at the problems that they have, and you can provide the right solution, regardless of the cost, they're always going to remember you for the rest of their life.
Absolutely.
That's how you build practice loyalty. That
Yes.
will elevate your practice.
Yes.
That will elevate you as a person personally, but also professionally as well.
It's very rewarding.
Absolutely. I mean, when you see someone that's been suffering for years
Yeah.
and no one's actually had a conversation and found a solution for them, but then they walk into your office, and to your point earlier, you become the hero, I mean, that touches me. I mean, there's times where I have patients come in and I find a solution, no one else did it, and they're crying, and I'm like, well, damn, I'm starting to cry too. And I'm trying to sit there and be hard, you know.
I have
but
a
I'm
lot
like,
of criers.
That's what I'm saying.
Yeah.
It's game changing.
Yeah.
It's game changing.
Yeah.